now we're going to test the muscles around the core and the trunk. The first one up is Rectus Abdominis. It is a trunk flexor. So the first thing we're going to have to do is have the patient sit on the end of the table, knees together. If they can't hold their knees together, it's usually a sign that the muscle is inhibited or that they're cheating. So make sure you pay attention to getting those together. The next thing you want to watch for, make sure they sit up nice and straight. If he slouches, then when I do it, I will miss the muscle test, even if it's inhibited. So I'll have them get up, cross, and if I'm testing, let's say, the left rectus abdominis, because we can test the left and the right. So I get in here, I stabilize here, I stabilize at his wrist, and then my arc is like this. So press into me, and that's the test. So now what we can do is we can further divide the core musculature into, if we rotate him towards me, and I press this way, this is going to be external oblique, the anterior division. Okay? Right. So this is the right external oblique, anterior division. Okay, so once again, knees together, ups nice and straight, cross, rotate towards. I'm going to stabilize at the knees, make sure they don't come apart, and I'm going to push that way. And that's the vector. And once again, it's not straight out, it's in that rounded vector. Okay, so then now we can keep them right here while we're testing, and we can test the internal obliques, the anterior division of internal obliques. So once again, feet together, or knees together, and I'm pressing here, going this way. So press into me. And that's the internal oblique anterior division. Now, we can keep them here again. We can go over here and have some fun. We're going to do the internal oblique, the left internal oblique, the lateral division. So we'll stabilize, and I'm going to be pushing this way. Press into me. Okay. So now, we have external, we have internal covered. We can do transverse abdominis. So what we'll have them do is, once again, knees together, rotate. I'm going to come in here with my knee and stabilize against his, so I can use the torque basically to get the muscle. So I'm going to be spinning him like a top, and he's going to be trying to resist that. So resist me. And that's it. And that would be, and then you can do it from the other side. You can rotate him this way, and I can go this way. And it's the same way. Okay? Okay, so just a quick recap. Rectus abdominis is right here. The right external oblique anterior division is here. The left internal oblique anterior division is here. The left internal oblique lateral division is here. The right external oblique lateral division we can do supine. So that's the patient to go supine. We bring his legs toward the right side because we're testing the right external oblique, which we already showed you the anterior division. Now we're going to be showing you the lateral division. So legs go towards the side of the oblique that we're testing, and I will ask the patient to keep his legs over here as I pull it back towards midline, stabilizing his hip here. So go ahead once again. Okay? So that's the right external oblique lateral division. Now, it's a slight variation on the QL, so now we'll be moving around the trunk and getting into the QLs, which we know are huge in our profession anyway. So all you do is you keep the patient's legs on the table. If you pick them up, you start doing external oblique. So you keep them on the table over here. Once again, I'm stabilizing at the hip, and I'm pulling in an arc around. So this is going to be his right QL, and I have Conrad basically push his legs this way, and I'm dragging. If I pick up, I'm getting a different muscle. That's not good. Some people will show it like this, some people will show it like this. It's your preference, and it also depends on like the stickiness of your table, so just find what works, but make sure the legs are on the ground. Okay. So we can also check Sacrospinals, also called erector spinae. We're not going to do the divisions, we're just going to do a group test. We know that there's 3 muscles that make up the erector spinae. So what we're going to do is we're going to have, let's test the left one first. So he will roll back like this, like he's doing like a quarter roll look back. I'm going to stabilize at the sacrum, and I'm basically going to push in an arc down and out like that. So press back into me, and it's this way. So if he brings it back and I just push down, that's no good. But if I get it like this, it's a totally different feel. And once again, that's the art of muscle testing. That's why we practice. Okay, I think that's all it's fun. Okay, so glute max goes like this. It is, you test it by moving the leg past 90 degrees because we don't want to be recruiting hamstrings when we do this test. So we bring it back here. We lift from the knee, bring it up here. We're going to have the patient basically hold this position. So I'm going to leave him and say, can you keep your toe, or can you keep your heel and push it up to the ceiling? I'm going to brace with one hand at the lower back. I'm going to put my other hand at the belly, and I'm going to push down. And it's down in an arc too. Okay? This is a big muscle. You can lay into it. Because if you're testing it just like a little, you know, like a little scaling or something, you'll miss it every time. It's a big muscle, so you can usually lay into it. If it's locking, I mean, you're going to be able to almost sit on it, especially with a guy of Conrad's glutes. Okay? So now we can test moving around the hip now, or just the pelvis. We can do hamstrings. Hamstrings obviously very important. We can do, I'll show you the group test first. So basically I'm going to bring his leg up about 45 degrees. I'm not at the ankle, I'm just below, or I guess just above, you could say. I am going to stabilize at the belly. I'm not like holding the belly because that's actually messing with the muscle. So I'm just lightly stabilizing here, and my force is going to be like this. The most important thing for the hamstring, because it is such a strong muscle, is making sure that your lead arm or your testing arm is straight. If I'm like this and I say, Conrad, kick up, I'm going to miss it. But if I keep this nice and straight, so this is a nice direct lever, and I say, kick up, Conrad, it totally changes. And remember, everything's in an arc, so this is your arc, okay? So, and that's a good instruction, is just kick your butt, is usually the patient instruction on this type of test. So that's the hamstrings as a group test. Now, okay, so we just did the hamstrings as a group. We can show you the individual if you want to get fancy and test medial and lateral hamstrings. So we're going to point the foot in and the toes pointing out laterally. So foot a little bit in, so we're not quite like this, we're a little bit like this. And my vector is going to be down and like towards the, basically the midline, I guess, of his leg, so to speak. So I'm going to say kick up, and that's my vector. And that's for our biceps femoris, that's for the lateral hamstring groups, okay? So if we're going to do medial, basically to align this, the leg goes out a little bit and the toes go point towards the medial, and then my vector will be this, okay? So go ahead and kick up. And then, so that's the each division of the hamstring. The next one we can do while we have him prone is the anterior stabilizer of the sacrum, which is the piriformis. Now you can test piriformis in more than one way, supine, prone, but we'll test it prone here. So basically you have a fist in between the legs to keep them spaced out. You're going to bring the leg up to 90, not like here, not like here, right at 90. That's very important for the muscle. Now, I'm going to put my knee and stabilize the lateral part of his knee, okay? Now I'm going to let his leg fall in here, and I'm stabilizing his opposite belly of the hamstring, and I'm going to be pulling like this, just below the ankle, just like this. And I usually will show the patient what motion I want them to do, so I'm going to say, Conrad, I want you to move your leg like this, and I'm going to pull it out. So I'm going to, and that's it. Okay? So that's piriformis. And now we can flip over to the other side. Okay, so now moving around the pelvis, we're going to test glute med. We're going to have the patient on their side. See how Conrad is stabilizing the table here? But the most important thing is to basically to keep the hips stacked. If he cheats over here, he's recruiting. By getting him perfectly at, I guess, perpendicular, you could call it, to the table, then we're going to be just getting glute med. So he's already gotten into a good position with his bottom leg flexed like that. I'm going to bring the leg straight up like this, straight knee extended, slight internal rotation you could argue. I'm going to stabilize at the pelvis, just above the pelvis here, and I'm going to have him press up into me, and I'm going to press down. So, yeah, we could do that too. Okay, good? Good. And so the motion is in an arc, once again. It's not straight down, because straight down will be different. In an arc, it's different. Okay? So transitioning into adductors from glute med, the patient still has side posture. He's bracing himself on the side of the table, which is good. I'm going to stack his hips again. I'm picking up his top leg, and I'm basically stabilizing like this. Now I'm going to pick up his, I guess this would be testing the right adductors. I'm going to have him hold it there, comrade, and I'm basically pushing. You were right on that one. And then down it goes. It's a very long lever position, and it's not super doesn't have a ton of leverage for the patient, so this one is one that you have to take time to get used to what a weak one versus a strong one feels like. But that's the adductors. Okay, so we're going to flip them over supine now, and we'll just test a very easy one. A very basic one is going to be Rectus Femoris. It is a hip flexor and knee extender. So what we can do, so we're going to bring the leg up not to 90, just below 90, and this is not going to be, the leg is not going to be at 90, it's going to be slightly above. An obtuse angle, if you will. Okay, so I'm going to get into a good position because rectus femoris is a strong muscle. And notice that my forearm is right in the line of drive. So I'm going to have him do this move, so go ahead, press back to me. And I'm pressing like this. So I'm stabilizing under his ankle like this and pressing through the belly here. And that's the muscle test, okay?